so Emma Masori and Bani Asori Penifo. I will dive in because we have a lot to cover. See, I will dive into the topic right away. And then after that, in the presentation, we will have question and answer. So hopefully any question you come up with during the presentation, I'll be able to answer for you. So we are talking about GLP-1 RA medications. GLP-1, is my video on? Yes. Okay. All right. I just got a message that I should turn my video on. Okay. All right. So GLP-1 RA medications and weight loss. That's what we're talking about. My goal is that I want to help people have more information about this new medication. Everybody is talking about it. Social media is talking about it. Celebrities are talking about it. I want people to have, a lot of information about this medication so they can make an informed decision whether they want to be on this medication or not, and not just go with the trend that happened, the social media trend, because I do see a lot of people, starting to use this medication. It's becoming more and more popular. A lot of prescriptions are coming in for the medication, and the only thing people are looking at is the weight loss version of this medication. They're not looking at the whole picture. So hopefully by the end of this presentation, you will have a broader picture of this medication and make the right decision for yourself. Now, GLP-1 RA, it stands for glucagon-like peptide 1 receptor agonist. It is a big name for a class of medications. Now, we will dive more into it as the presentation goes on. So this is what we're talking about. We'll talk about the rise of GLP-1 medications for weight loss, because there are other indications for this particular class of medications. But your focus will be on the weight loss, because that's what a lot of people are using it for. We'll also talk about what GLP-1 medications are, the types of GLP-1 medications that are available on the market, and then how does the medication work, the benefit and the side effects. We'll also talk about risk and complications of the medication. Now, before I go on, I have to put a disclaimer here. So I will read this Ewo Brofumu. Said the information provided in this presentation is for educational purposes only and is not intended as medical advice. Please consult with a qualified healthcare professional for personalized guidance and treatment options. I do not assume any liability for actions taken based on the contents of this presentation. So basically, what I'm trying to say is the information I may share with you today, it is for educational purposes only. It is for you to make the decision yourself and also involve your primary care physician or any qualified healthcare professional or basically a personalized guidance and also a personalized treatment options. So back to the popularity of this medication. I think that a lot of celebrities have come out talking about how they've lost a lot of weight on these GLP-1 medications. I think the most popular one a lot of people know is Ozempic. I mean, you see the commercial on TV, you see a lot of people talking about it. A lot of big celebrities have been talking about it. So this is the magical weight loss drug. It's available on the markets. So we'll take a look at Oprah Winfrey. You can see, Oprah Winfrey, say, why you're so slim? But you have the picture now, no, pink now. She was heavy, but because of this medication, this GLP-1 medications, it's me abuano amane lusu weight. And so you can see her in the purple dress. She's very thin. She's looking healthy versus the pink sweater na no osheno. Another celebrity by the name of Harvey Fierstein. Or also, so we're showing the picture. Yeah, he was very heavy. He took some of these GLP-1 medications, and now you can tell that he's lost tremendous amount of weight. You can even see it. Another one will be Tesla King, Elon Musk. And also just recently, Christmas he took a picture dressed as Santa Claus, but a slimmer version of Santa Claus. And also has been using this medication. And a lot of people are getting very familiar with Edro say, I want to do this presentation. So social media, because of social media, and the information echo around very quickly. Now, since this medication became available on the market, as pharmacists, from 2019 to 2022, in a 3-span year, we have seen an increase of more than 2,000% of prescriptions for these GLP-1 medications. Now, 12% of U.S. adults, and so HSA, at some point in their life, they have also taken one of these medications before. And then we see that patients are more diabetes, there's a 43% rise in patients with diabetes or use medication. And then another 22% in patients are diagnosed with overweight or obesity. So you can clearly see that this medication is on demand. People want it. Manufacturers are pushing it. Celebrities are talking about it. Social media is taking it also very far. So now let's talk about what GLP-1 receptor agonist medications are. Before, I explained that GLP stands for glucagon-like peptide 1. And then the RA stands for receptor agonist. We'll go a little bit into it and let's see what's receptor agonist it's here. But for now, GLP-1 medications, to me, it's a specialty medication. You self-inject it. It's self-injectable medication. It is approved by the FDA to treat 2 different conditions: type 2 diabetes and also obesity. Now, these medications, out of pocket, they are very expensive. Not all insurances cover this. In order for insurance to cover, you will need diagnosis from your doctor. There are some parameters you need to meet. So out of pocket costs, and also one of them will be able to be, they pay out of pocket from the pharmacy I work with, and they pay about $1,600 for just 28 days supply of this medication. So it's quite expensive. So what are the types of GLP-1 agonist medications? So that we have different types available. We will name them in the next slides, but what makes them different? ASA. It's how you take it. Are you taking it orally? Are you taking it are you injecting it? And now say how often you take them. Are you taking it on a daily basis or on a weekly basis? And then also which disease state are taking the medication, also is some of the ways that you differ those medication. Remember, I said GLP-1 agonist, it's a class of medication. It will go through it. These are the popular ones that are out there. Now we have a short-acting and then we have a long-acting GLP-1 medications. The short-acting is the one that you take it every day. And at the long-acting, you take it on a weekly basis. So short-acting, you have some of the popular ones like Byetta, and only you take it twice a day. You have Victoza. Victoza, the indication for it is only approved for people with type 2 diabetes. It's normally, like with this presentation, we're not too concerned about the ones that it's approved for type 2 diabetes. Now, our main look, will be on the one that are approved for obesity and as a weight loss. And then you have Saxenda. Saxenda, on a high doses, it's approved for obesity. And then the only oral GLP-1 medication currently on the market is called Rybelsus, and tablets. You take it orally, and it's also for type 2 diabetes mellitus. And then when you come to the long-acting the long-acting are the ones you take on a weekly basis. For all these weekly basis, injectables. So you have Trulicity, Bydureon, Ozempic. I know that Ozempic is very popular, but keep in mind that the ones even approved for type 2 diabetes, they all have the potential to help you lose weight. You will see that some people, even though Ozempic is approved for type 2 diabetes mellitus, people also use it to lose weight in addition to say more air control or more type 2 diabetes, And then you have Wegovy. Wegovy is only approved for weight loss. You have Mounjaro. Mounjaro is type 2 diabetes. And then you have Zepbound. Zepbound is only approved for weight loss. So from the long acting, which is taken on a weekly basis, the most popular one will be Ozempic, Wegovy, Mounjaro, and Zepbound. Zepbound, just came on the market maybe not 2 years ago. That one is fairly new. So a kwan beso and a GLP-1 medications, a year juma. GLP-1 again. I'm trying to recap. GLP stands for glucagon-like peptide. It's a glucagon-like. Adibia esse glucagon. So glucagon-like peptide 1. So a kwan beso and a year ejuma. So you say how a GLP-1 agonist medication a year juma. And was say a natural hormone be a way your body move. Your friend a GLP-1 hormone. So there's a hormone be in our body. A friend a GLP-1 hormone. Now these hormone will your small intestines emo. So your intestine on some. I think that's what it's called in Chi. On some ketwano. A GLP-1 hormone no ewo. So obia nipebia ewo GLP-1 hormone. So keep in mind, say GLP-1 hormone no is different from GLP-1 receptor agonist. I'll come to that. So for the purpose of this presentation, look at it as two different things. So you have GLP-1 hormone, which is a natural thing, and your body move. And it's found in your small intestines. Now, the hormone or the natural hormone GLP-1 it has several roles that it play in our body. The first one is say udidia GLP-1 hormone a trigger. When we say something, we say it's a hormone. The word hormone it means chemical messenger. So a messenger be a chemical be where your body more. It sends messages to parts of our body to do something. So the GLP-1 hormone, as soon as you eat, a trigger your pancreas. Organ a friend of pancreas, which is responsible to release insulin into your body. GLP-1 eboa. Catch o pancreas, they say pancreas, a bowl, starting to release the insulin. So it will start to release insulin into your bloodstream. Because it will be broken down into glucose, which is sugar. So insulin is ready to transport that sugar from your bloodstream. Send your sugar level and cholesterol. Naturally, this is the work of the GLP-1 hormone. Number one, it helps trigger insulin release from your pancreas. Number two, it blocks what we call glucagon secretion. Glucagon also another hormone be a body more. No, ne say a boy it raises your blood sugar high. Remember, insulin is released to decrease your blood glucose, which is sugar mono. Glucagon does the opposite. Glucagon it releases like it sends a message for like the glucagon hormone a sending message. Emma or liver it release glucagon or send your blood sugar raise it up. It's your fun to say, oh, fasted, you are fasting. And I wounded you for a whole day. The reason why you are able to actively work while you're fighting is because your body naturally says, oh, but I still need to process energy. I still need to be able to walk. I still need to be able to, use my brain to think. And glucagon hormone no ebeko no wako release glucagon into your bloodstream, which is sugar. Send your sugar no will be turned into energy for you to use. I hope that makes sense. So insulin, udidia, because you have food in your belly, you're going to break it down to sugar. So insulin will tackle the sugar to reduce it. Now, so we need sugar, so sugar is very low in your bladder. Then the glucagon is released to increase your sugar. So it's like check and balance. The way your body, why in a check and balance. So GLP-1 na a walk or small intestine no nejuma bakwa or yenso so enono. Another one say is it slows your stomach emptying. So udidia GLP-1 no is naturally it's supposed to slow down the emptying of your stomach, which means our body no be release less glucose from the food you eat into your bloodstream. So udidi ya aduane no pass it through your gut system. Now it could go with intestine. Now it's being absorbed into your bloodstream. You want it to absorb on a slowly basis. Send your at the level of your sugar now blood mono. It will be optimal and go too high. Into GLP-1 no nejuma awoye no eboa it slow down your digestion. Send your the glucose your food will be broken down into no when it's being released into your bloodstream. It releasing in kakra. And then the fourth thing say GLP-1 no it goes into it communicates with your brain and tells your brain say, oh my I feel the aduane atomy yen mame ini se me di bebre, and I said the feeling of fullness. You feel full after eating no. And then our brony friend is satiety. Inti you feel one main. That's one of the communication at GLP-1 natural hormone no within our body. So 4 things it does. Number 1, we're going back again. Number 1, it triggers the insulin release from your pancreas. GLP-1, natural one. No, the natural one also it helps block glucagon secretion. It's the glucagon na and be free will live about while you are hungry, to make sure that you have sugar in your body. It blocks that glucagon secretion. The third one, ASA, it slows stomach emptying. And then the last one it does is it communicates with your brain and tells your brain, say, mame, and he said, mididibio, I feel full. So then let's go to how the GLP-1 receptor agonist medications, what we talked about was the natural hormone called GLP-1. It occurs in everybody, which is found in our small intestine. Now, how do the medications you develop right now? You classify as GLP-1 receptor agonist. How does it work? So GLP-1 agonist medication, they designed it in such a way, say, it will copy exactly what the GLP-1 hormone, the natural thing that you made the boy, your body more. So science of what now say, and on one case, I develop another adibia or my yamana set the natural hormone. So it's which is agonist. When we use in medical terms, they use the word agonist. It means that something that has been manufactured. Attaching itself into cells where your body move and cause the same action as the naturally occurring substance. Into GLP-1 agonist medications, is designed to mimic or to copy or to work the same way as the natural GLP-1 hormone. I work with body. So in other words, GLP-1 medications bind it to a receptor we call GLP receptor. I know it's too scientific. I'll skip that. So This tells you that the higher the dose of GLP-1 agonist medication that will be taken on, the more extreme the effect will be in your body, because it's mimicking the natural hormone. So now that we've talked about GLP-1 natural hormone and then the one that has been developed scientifically, how does it work for obesity? The same way we talked about the 4 things that we talked about, how it releases insulin from the pancreas, how it stops glucagon secretion, how it slows stomach emptying and also increasing how full you feel. So that is the exact same way ejuma. Now, in order for your primary care physician to prescribe this for you, you have to have a BMI of 30 or higher, which is classified as obesity. And then sometimes, patients are BMI between 25 and 29.9, which is classified as overweight, And so sometimes if they have some health conditions, let's say they are diabetic, let's say they have some heart disease, underlying heart diseases, those people may also qualify to be on this medication. So now I want to talk about the potential benefits and also the risk of GLP-1 agonist medications. So what are the potential benefits of GLP-1 agonists? Number 1, in addition to say ebeboa ama a decrease or sugar levels in your bloodstream, which is good for people with diabetes, type 2 diabetes. Now, they are studying, almost studying very well in people with type 1 diabetes. So when I say diabetes, I'm referring to people with type 2. So in addition to helping manage your glucose level and also helping people lose weight, it helps you lower your blood pressure. How? Because if it helps you lose weight, losing weight automatically helps you with your blood pressure. So that potential benefits to it helps you lower your blood pressure. It helps you improve your lipid disorders, or high cholesterol level, low HDL level, high triglycerides. All these lipid panels, it helps you because you will have that weight loss, so you will see better improvements in your numbers when you have a lipid panel done. Another potential benefits, it helps improve fatty liver disease. A lot of people are more fatty liver disease. We see improvements when they are put on these GLP-1 agonists. Another one it also reduces your risk of heart disease and kidney disease. As a matter of fact, people with metabolic syndrome, usually they like to keep them on these medications to control them from having some cardiovascular diseases along the line and kidney diseases along the line. Another benefit, it delays the progression of diabetes related nephropathy. So on nerves, or diabetes, the long-term complications, it affects your nervous system. They see being on this medication helps slow down that progression. Now, I want to also take a look at some of the side effects of GLP-1 agonist medication. So the most common side effects, you will lose appetite. Remember, the GLP-1 natural hormone, and then the one that is being scientifically made, which is the agonist, and they all help you feel like, warming until you will lose appetite. It communicates with your brain, oh, I'm full, even though you have not eaten anything. Injecting that GLP-1 medication in your body on a weekly basis, because you have more of this GLP-1 in your body, it will communicate to your brain, you are full. There's no need to eat, because a common so you have loss of appetite. one of the common side effects is nausea and vomiting. Almost 80% of people who start this medication, they do experience some level of nausea and vomiting. Diarrhea also is another side effect. But keep in mind that these side effects are more likely to happen when you start the medication. But with time, as your body gets used to the medication, those side effects minimizes. And I say, while you're on the medication, sometimes your body gets used to one dose. You find yourself, for example, if you are taking Ozempic for diabetes and getting also the benefits of weight loss now. Ozempic, you start with 0.25 milligram, and then your body get used to that milligram. You have to increase it to 0.5. You have to increase it to 1 to 2. And the more you are increasing the dose, you can potentially start that common side effect of nausea and vomiting all over again. Another side effect, it's common but not too common, dizziness. Some people experience mild tachycardia, which is increased heart rate. Some people also have infections because it's something that you are injecting into your body. So if you don't take proper care with, making sure that once you clean, you are wiping the injection sites, you have to take precautions to make sure that you're not introducing bacteria and anything into your body because it's injection. Another complaint is a headache. A lot of people have headaches, and then indigestion. Indigestion is partly due because it's like you don't feel like eating anything. Some people go on this medication and for days maybe because they don't feel the need to eat. Another one is that you may have, temporary itchiness and also redness on the site ube injecting, and also error. Now let's talk about the severe but very rare side effects of GLP-1 agonists. Some of the severe side effects, get pancreatitis. For some reason, with clinical study of people did experience some pancreatitis. It's one of the severe side effects of this medication. Another one is medullary thyroid cancer. It was very common in people or more family history of thyroid cancer. Another one is also GI issues. And I want to take a little bit of time to talk about the GI issues, especially gastroparesis. Gastroparesis, say, aduane eto wo yam na afei wo intestine like a monche can normally aduane to wo yam a like the intestine nankasan ewo ne pesa echo to make sure that aduane is being absorbed. But in this case, aduane to wo yam na o intestine I paralyze it like like it goes into a knot. I don't know if that makes sense. So obiya fasting for a very long time. Those who can fast for weeks and months, obiya fasting we are medically say break you will fast now. You have to start with liquid medications. I mean you have to start with liquid food. Adriania light. So accommodate we muchasa na udidi na udi aduane bi heavier. It can paralyze your intestine. It makes me unnoteno, and that thing can kill you very quickly. So with GLP-1 medications, especially people who have been on it for a very long time, 2, 3, 4, 5 years. Omo anya careful na aduane eto omo yemu a, these paralysis of the intestine can happen, and it can kill them, and it can also cause obstruction of the intestine. And so that's one of the biggest long-term side effects of it. The issue with GLP-1 agonist medication, ASA, When you start it up, say if you are on it for a long term, it's hard to get off of the medication because immediately when you get off now, you may start putting on that weight. If you don't change your habit of living, if you're not exercising, if you're not changing, like you are depending solely on the medication to help you lose weight up, the chances of you being on this medication will be for your lifetime. It will get to a point that medication will not make you lose weight because there's no weight to lose, but it will help you maintain the weight now when you know. Obiba Pharmacy for the first time now, or the advice I am the moment, in addition to you starting this medication, make a lifestyle modification. Maybe start exercising, eat clean, eat aduane papa, and because of the fact that this adrenal, if you're not careful, aduane krane and all consult the become one need to know. I always tell people, say, on a daily basis, force yourself to eat something healthy. Because you don't want your intestine to be there, not receiving any food, and then the time then you get this gastroparesis. So it's important to say if you're on this medication, even if you don't feel so what did you like time yourself, so okay, at this time I need to at least put something in my belly. Something small, it's okay. Put something in your belly, something healthy in your belly. Send your belly, you won't end up with the gastroparesis. No. Another one, acute kidney injury. And I say kidney injury, it just happens on a sudden basis. And the last one would be worsening diabetes-related retinopathy. So diabetes complication, sometimes it affects your retina in the eye. Now we see, there's a lot of people that or more retinopathy, gets worse while they are on this medication. Now, I want to talk about another side effect, which they have termed as Ozempic face. Sometimes I can tell just looking at Nipane face to say this person is using a GLP-1 medication, but they have termed it Ozempic face. So with Ozempic face, you will see that because of the rapid loss of fat, you will see that Nipano Oluku so hollow. I said, me how I make a hollow me in chi Oluku way be, and you will see that the more lip size, are changing. Their cheeks look different, or more chain, a lot of wrinkles on the face, or many akeka komukakra, and then osha or more jaw area and the neck area now, it's sagging. Like there's a lot of sag there. And most of them know is because they lose the weight so rapidly. And there are some people also, they don't want to have the Ozempic face. Into what they do, and they say, they stay on one dose for a long time and then transition slowly. Into the more slower you lose the weight, you won't get that Ozempic face now. The Ozempic face side effects, you won't get it. A lot of people are significantly, and then if the second picture I showed of celebrity Harvey, you can clearly see that he had an Ozempic face. It's because of the face sagging and the neck sagging, the only way to treat that sag will be to have plastic surgery to tighten the face up. So I'll show you a picture, like a side-by-side picture of Ozempic face. So her mommy, her face was very plump on the left side. It was very plump, but also the right side after she was on Ozempic now, you can see how the face is drooling. You see the wrinkles. You see how the eyes, is sunken in. Also the neck area now, how the neck area, I guess saggy. The jaw area is saggy. The cheeks are in. The lip, the shape of the lip, kakra. So these are some of the side effects you can experience with these medications. What are some of the complications? I'll go through this quickly so I can have time for questions. So GLP-1 agonists, sometimes, some people may have allergic reaction to it. So because it's a GLP-1 agonist, is made to mimic a natural hormone in the body. Sometimes, we inject it, your body, your immune system, will say, oh, we have something foreign in our body. We need to go fight it. So some people, we inject our medication, they have an allergic reaction to it. And some of them, unfortunately, it becomes so severe, which we call anaphylaxis. So they need to call 911, and some people can potentially die from this. So some of the symptoms of anaphylaxis, I say, inject your donor, you feel shortness of breath, like intimate breathing, all of a sudden, and same be hives, you have difficulty swallowing because your tongue is swelling into untimi and minibibia. Some people also experience severe abdominal pain, your chest, you feel like say chest tightness, that's what ubenya heart attack be, or you're feeling like as a bibia the show so like a feeling of doom or dread. So these are very severe forms of side effect, which is an anaphylaxis effect with the medication. Another one is it's not safe to use during pregnancy. Or more studies in animals, like pregnant animals, they found out to say, and more or more injection even when they had the baby now, the babies came out with abnormalities. Right now, this medication cannot be used during pregnancy. If you're using the medication and you do become pregnant, you do need to contact your doctor immediately. And now, if you are of age, you're pregnant, now you are using these medications, you want to make sure that you use a reliable, form of birth control that prevent you from becoming pregnant, because the potential of you having an abnormal baby is high with this medication. Another one, the potential of using this medication and having hypoglycemia. Hypoglycemia is low blood sugar. So there are some people who are naturally, more blood sugar, it's not high. Now, what's a drill we say, whenever your sugar level falls below 70 milligrams, we say you are hypoglycemic. Those people should be careful. Some of the symptoms with hypoglycemia, you shaky, you are sweating, dizziness, weakness, or you feel nauseous. Those people if they need to be on these type of medications, which is usually not likely, but if they do need to be on this, the advice is they should probably get some glucose tablets. They should always have some food be a ben warm. So in case you say when they are feeling these symptoms of hypoglycemia, now they will just put some of the glucose tablets in their mouth to bring up the sugar level. They don't pass out. So the presentation right now and open the floor for any questions or any contribution.
I have a question.
Okay.
The question is no. Yeah, they say the other so reduce weight BMI was low. Why try obese won't me and lose weight on your own. No, what that say we'll take it. We'll take it GLP What are the side effects? I want minimum so what can be what can you? But okay, the question is like say yes, I was we take it go on now we take nema was so tia na sanka koswana ye bia wo exercise no no.
Okay, that's a very good question. I think that it's an individual case by case answer, and that makes me at the amount.
Okay.
It depends. So, BBI, you have to weigh the risk and the benefits, So, risk and benefit analysis. Now we share. Now say the risk, outweighs the benefit of it. ehu hia se obeje. And I say ehu hia se ube yusu adrono. But what I said the benefits no to you no or to your health outweighs the risk now. Then yes. So the whole reason I wanted to do this presentation is that I do see a lot of immigrants, a lot of Ghanaians, a lot of people are even I may personally know have been using this medication, and a lot of people have questions. It's the presentation or the purpose of this whole presentation is to give you that information so that you will make your own decision. So, okay, that's a benefit, say a beboa, you ever say you are diabetic, uncontrolled, like diabetes, it's uncontrollable. Why you can okay, that's it. Taking the GLP-1 medication, beboa to lose weight, to bring your sugar level, to decrease your chance of having cardiovascular disease and all that. I don't see the reason why you shouldn't go for that, because in that case, the benefits will outweigh the risk, But you.
A very nice presentation. I mean, as a man, any one about child person, and I answer my man and so, and so does it have effect on our productivity? And I said, yes, one can remember, I said, but you mean, I'm buying a crack,
Okay, thank you. That's a good question. Okay, so GLP-1 medications, yes, and yet for a man, it's me FB. However, during my research, it's still a drug. It's fairly new on the market and it's still being studied in many different ways. And see, I have not come across anything that talks about it makes men ineffective, sexually, and I say, producing what they're supposed to produce to make a child. I did not come across anything like that. But yes, the benefit, as far as the benefits and the risk when it comes to it be a pancreatitis, all the common side effects, all of those things can be experienced in men as equally as women. But when it comes to the sexual aspect in India, I have not come across anything pertaining to men. But I hope some answer our question. No problem.
Me bacho me a question no.
Bacho you.
Sorry. Me bacho me pese me bista se. Metformin no. It is similar to me refer drone in there for diabetes drone it me control diabetes in any way.
Is it a tablet? A tablet, Anna?
No, I'm talking about the metformin.
Okay, Ubusa said metformin no. But your Sabusa question, it's not very clear.
Metformin no. Metformin any a journal now say and also to me here for diabetes and control diabetes for weight and fat and so no. And I'm person business metformin. So yeah, and does it control weight? And I said, what exactly the benefit of taking the metformin?
Okay, thank you. Okay, so metformin so it's a class of medication that you treat diabetes, type 2 diabetes to be specific. So metformin so it does something in your body. It helps your body to communicate with your pancreas to secrete more insulin. So the more insulin you have, the more sugar no every umojamu. So metformin does that to help people with type 2 diabetes. Metformin it doesn't have that weight loss property I hope you are following what I'm saying. It doesn't have that weight loss property Depending on your A1C, the level of your A1C, and how the complications that you have with your diabetes, metformin can only, like, obi wo ha obetumi afa metformin depending on the diabetes the level no. Metformin can be sufficient for that nipa no. Ebi obi here want metformin no keke. But most of the time no, with what we see no, metformin it's not in most cases no, it's not sufficient to treat diabetes, type 2 diabetes no. Most of the time once you have many metformin, they will add another medication, just to make sure say diabetes is being controlled. This medication, the GLP-1 medication, injections, all of them, with the exception of 3 on the markets, are all approved for type 2 diabetes. The ones that are approved for type 2 diabetes can help you lose weight. But the specific 3 now, the other market is not for weight loss, like Saxenda, Wegovy, and Zepbound. Those 3 ones, and we don't give to people with diabetes. And for people who have obesity, more problem here, obesity. So if you are diabetic now, or metformin, so if the metformin is not controlling your diabetes now, you can equally take the GLP-1 medication to help with, your sugar, decreasing your sugar level. I hope so I'm answering your question.
Yes, but
Okay.
I have a question again.
Okay.
And not your friend is saying, Sebi obi need diabetes, they said Johnny Mana. What other diagnosis that anti-abema yamano that metformin no? Actually, are you clear?
Okay, so metformin can be used for other things. People with PCOS, most of the time, doctors will put them on metformin. The reason is because a lot of people with PCOS, sometimes they have insulin problem. They may not be diabetic, but because of the PCOS, insulin imbalances, doctor bits me the want to metformin to help you with PCOS. So that's one of the common indication for metformin, other than type 2 diabetes, PCOS. Metformin. So metformin can be used for multiple things: PCOS, diabetes, other stuff. But those are the 2 common indications I don't have a debate to.
Okay, thank you. But Obi or question, Obi and you meeting maybe one more question.
Question back could be about chat and say, can you take GLP-1 if not diabetic? If you are not diabetic, your doctor should not put you on any GLP-1 medication now. You're proven for diabetes. Unless you say, you're obese, your BMI is more than 30, then they can put you on the GLP-1 now. It's been approved for weight loss, which is Wegovy, Zepbound, and Saxenda. I hope I've answered that question. Pacho, the old question.
No question.
Okay.
The question is what I'm wow. You can say what I'm wow. And for who say we are skinny on. And so could you not wait to swear? I'm could not scale, so now we weigh we serve what. Now all your calculations every year, but also BMI no. Even a obesity there so one am who appear like a skinny person. No son no. No we say will BMI no the issue too high so appearance wise the people see say we are skinny. And no, does it call for you to take GLP-1 no?
Okay. So we'll call Dr. Jose here, right? Now catch what doctor said. Doctor, I just learned about GLP-1 medication. The BMI above 30. Put me on this medication. A good doctor will not put you on that medication right away. Obeka Charles said, have you tried lifestyle modification? Have you tried to change your diet? Are you exercising? Unless having a BMI of above 30, you have another condition now, and that complicates you to have maybe a cardiovascular disease or a kidney disease along the line. Most doctors will say, oh, let's try lifestyle modification first. If that one fails, we'll try something different. If that fails, maybe then I'll put you on GLP-1 medications.
Okay, you're funny, so with the why you what training in so Uncle Siaga, it's a good so baby.
So my question is it the BMI non kwana it could be below 30, and I said there's a complication here you are trying to so ano.
Oh, the complications be any one but if I say BMI, follow within the normal range,
Okay, so if no complication and you are only concerned about BMI, but physically, you don't look say you are obese. I don't think that there's a need for this because look at the side effects,
That's good.
If you look at the side effects now, you have the potential of getting that side effect, And so you won't gain any benefits in there. That's why I said you have to weigh the benefits and also weigh the risk.
Okay, thank you.
So, my question is, I will fry away obese, obetting me, Edna to Sa, Adria Walking Swana.
Very good question, Auntie. Say Aquadano Edi 12 or more. Yes. Because some of these weight loss medication has been approved in Kra as young as 12 years old. So as long as Aquadano were 12 years old, yes, they can put Aquadano on this medication. But like I said, I don't think any doctor will just right away put the Aquadano on this medication without Aquadano trying other things like changing the diet, exercising, doing other things, and say all else fail. Let's say that Aquadano is so much to say they are pre-diabetic. The lipid panel all over the place. Then maybe the doctor will consider to put Aquadano on a GLP-1 medication. So yes, as long as Aquadano be 12 or above, yes, they can take it.
That's
Any other questions?
That's about now. My question relate to how Grandpa you be about Ozempic. In the CCR, Oprah was accepted there of Ozempic.
Yes.
But initially, she didn't avoid that information. She tried to give them, and there she did it through some other means. Only thing I didn't see the fact that these type of medications they didn't even talk about a jumor for diabetes now. If you advert now, it focuses on the weight
loss. Yes.
Yeah. And the danger here is a lot of people get into these things in the American who doctor be worth is sold or prescribe a more, but pressure from patients now they forces doctors to go to that extent.
Yes.
Yeah. And so me fear in there how it's been advertised and all those things now. On my impression there or solve problems if you or what.
Right.
Without any side effects now.
Right.
And I will caution us there. Maybe these things on necessary. There are so many ways able to me do you lose weight in after fortunately for Ghanaians, they may fully appreciate Messiah why plumpy until there. Yeah, until the America what they send more tibia or that upper panel there more than one upper home and all those things, and that pushes them into sad situations. And then me feel Ghana for women about other means rather than the America there. Once you get on it, it's very difficult to get out of it. And it's purely addiction. And we are encouraging this form of addiction. So, me what you want to lose weight now. You will tell them that they are addicted to weed now, all those things. And it's similar to this situation. nti mo maame fo na ade wo me ndwu ho yie pa fall victims to these situations na ade because opra wa kwake fabi no we reduce weight nti emi mu contribution me dasi
bebre. But is there any other question? All right, and yes, the question being anywhere, I'll end it with this disclaimer. Say, I know that there was a shortage of these medications because everybody wanted to be on the medication, and so FDA gave an approval for compounding pharmacies to compound some of these medications. And with the compounding, a lot of people were sharing, recipes on TikTok, and people who are compounding in their backyard and, selling it to other people. So let's be careful. Say, if the need be, say, you need to be on these medications, go get it from the right route. And kotono ekwanche ho, because these compounded one, you don't know how it's compounded. Now, idea we inject it to your body and so there. You don't want to introduce any foreign thing beer into your body at how. So if the need be, say you need to be on this medication, go through the right channel, get a prescription, go to the right pharmacy, get it filled, send it there, you will have the right medication. And kotono kwanche ho one shot, na wako proud. And see, thank you guys. I know it's a time, but thank you for your time. And in case you say any questions come up here, you can call me or send me a message, however you choose to, and then I'll answer it. Thank you for this opportunity.